Okay, good afternoon or evening or good morning to all of you. Thank you for joining us today for our program, Starting Your Program, Remote Enrollment, or Planning for Arrival for Undergraduate Students. Whether you're joining us from inside the US or from the other side of the world, on behalf of the International Students and Programs Office here at UC San Diego, we want to welcome you warmly and are looking forward to seeing you hopefully soon. ISPO is here along with the entire campus community to offer you a heartfelt welcome to campus. Though we know some of you won't be able to join us in person quite yet for fall, we're eager to welcome you and make you feel part of the Triton community from the very beginning. We like to think of ISPO as your home away from home, a place where you can meet others from around the world, learn from one another, explore your interests, and above all, feel comfortable here. Whatever this fall might look like for you, ISPO plans to extend the same warm welcome that we have for years for so many of our students, as you can see here at our last year's orientation program. I want to take a moment just to introduce our panelists, our presentation folks this afternoon. My name is Gabi Hoffman. I'm the Assistant Director of Student Experience and Engagement here at ISPO. I'm also joined by my colleague, Tricia Schuler. She's going to be helping answer some questions as well that you have. We also have colleagues Sabrina Wong and Pachia Vu. Both are from Housing Administrative Services, so they can go over housing questions that you might have. And then we have Jill Batika from Student Health Services. She's going to be talking about both student health insurance and immunization requirements coming up for this year. So before I go into the agenda, I just want to let you know that we, again, are here to help answer questions. You should all see a Q&A box at the on your screen. Please go ahead and use that Q&A box to ask questions of any of our panelists. We will go ahead and answer them as quickly as we can during today's hour-long presentation. And again, try to refrain from the chat box, but try to use the Q&A box. This is the best way to reach us. So today we're just going to go over the International Students and Programs Office briefly, what we do, who we are. Then we'll go over the SEVP updates, so that's student and exchange visitor updates, and the impact on enrollment for fall 2020. We're going to go over some options for either remote or in-person study, what planning will look like for you for this fall. Then we'll turn to our housing updates and information about quarantine housing. Then we'll review immunization and health insurance requirements for 2020. And at the end, we'll provide some getting started resources. And if we have time, we might be able to ask some of the questions you've asked out loud. But in the meantime, again, please feel free to put those in the Q&A box. So ISPO at UC San Diego is your one-stop shop for all services and programs for international students. ISPO provides immigration advising as well as non-immigration advising topics to help you understand how to navigate your program and succeed at UC San Diego. You're welcome to visit us virtually or in person, depending on what your fall is going to look like. We have 20 professional staff here to help you, student staff as well, so please contact us whenever you feel that you need to. Aside from advising and issuing immigration documents, we also offer events and workshops to support the successful transition of students to campus and student life, as well as to enrich the academic, research, and intercultural experiences of all students at UC San Diego. Okay, so now I'd like to take some time to review the latest Student and Exchange Visitor, or SEVP guidance, what it states, and how it impacts enrollment and arrival to the US for our new international students. I do want to just make a note that this presentation will not go over the specifics of employment authorization on or off campus. We ask that you please attend next Tuesday's webinar on August 18th that focuses exclusively on employment for international students in light of this new guidance. Today's presentation is focusing solely on enrollment and getting started at UC San Diego. The latest July 24th guidance from SEVP clarifies U.S. universities' ability to issue and maintain SEVIS records, so your F1 record or J1 record, for newly admitted students in the fall 2020 quarter to pursue a full course of study that is not 100% online. UC San Diego's Fall 2020 course offerings follow a hybrid model. So this is a mixture of remote as well as in-person courses. Under this model, newly admitted international students will be eligible to receive a Form I-20 for the F1 or a DS 2019 for the J1, reflecting a fall quarter start date, and they can seek entry into the US so long as they are not enrolled in 100% online coursework to meet the 12-unit full-time requirement and plan to be physically present in the United States. So what does this all mean in practical terms for you? So let's go over these different scenarios. I know this is a large chart here, but I want to go over just line by line what this means. So let's start at the beginning here. Are you currently inside or outside the US? If you are outside the US, we're next going to go to what your plans look like for the fall, whether you're going to enter or not. But let's look at our students who are already inside. If you are here and you've transferred your record to us, and if you plan to remain in the US for fall quarter, you are eligible to maintain your F1 or J1 status as long as you maintain full-time enrollment. Now, if you're outside the US, let's say that you are outside and you plan to enter the US for fall. You are enrolled in at least one hybrid or in-person course. If you are planning to do that, you again want to make sure that you are at least in one hybrid or in-person course. You cannot be in fully remote courses. If you are outside the US, you don't plan on entering the US, you want to remain in your home country, take all of your classes online. You don't have any classes that are going to be in-person or hybrid, then let's take a look at what you would do next. So for those of you who are remaining home, you are either staying to take online classes, or maybe you are deferring your program to start at a slightly later quarter. Then what we would need to do is we need to adjust the program start date on your I-20 or DS 2019. We would need to adjust this to the next quarter that you plan to enter the United States, which we hope is winter 2021. You don't have to have any other remarks put on that document. You just need the start date adjusted to allow you to enter. For those of you who do plan on entering the US this fall, you have at least your one hybrid or in-person course. You are eligible to still enter the US. You will get a fall 2020 start date. That is a September 28th start date. And you are eligible to receive a remark on your I-20 stating that UCSD's model of instruction is hybrid this year and that there are no plans for you to be in a fully remote set of coursework. Now, if you're, again, going back to those who are inside the US, if you plan to remain in the US for fall quarter, you can choose any courses you like. So this is the caveat here for our students who are inside the US. If you've been maintaining your status since March 9th in the United States, since the previous SEVP guidance, and you are staying in the US and you're enrolling full-time, you can take a full course load of online classes if you'd like. This is allowed. Again, as long as you maintain full-time enrollment, which is 12 units. You do not have to have your I-20 documents updated. You can keep them as is, and you can enroll in your courses and begin your studies on time. So looking at these scenarios, how should you begin your program this fall? So for those of you who are trying to enter the US for fall, who have their in-person or hybrid course, you may seek entry into the US up to the end of week 2, which this year is October 16th. And again, you should remain enrolled in at least one hybrid or in-person course. We do not advise switching or dropping out to a fully online course load because this would not be maintaining your status with the given guidance that we have. So you maintain that enrollment and you can enter up to the end of week 2, October 16th. If you are not planning to enter the US, again, you're taking all of your online courses at home, you must remain outside the US for the fall quarter and remain enrolled in fully remote courses. You can only enter up to 30 days before the program start date on your I-20. Okay, so for most of you, that will be a December date because the start date for winter is the 4th of January this year. And again, for our students who are inside the US, you can remain in the US and remain enrolled in fully remote courses if you'd like. So I know these are a lot of different choices and adjustments here, and we are talking about adjusting your paperwork. How do you adjust your paperwork? So if you're a student who's coming in for fall and you would like remarks and you're missing those remarks from your I-20 document, you can log into the iPortal, which is listed here, iportal.ucsd.edu, submit the new Admit I-20 DS 2019 amendment reprint request, and we will upload an electronic I-20 to your iPortal account that you can use for entry into the United States. The same amendment request type goes for those who are staying in their home country and taking online courses and who need a winter 2021 start date. You can also fill out the new Admit amendment request form, specifying what you need on your document. We will adjust your paperwork for you, and then we will upload it to your iPortal request for you. Again, for those staying here, you do not need to request any further documentation from us. So I wanted to just go over briefly here the registration process for hybrid, in-person versus online courses. We know there's a lot of different definitions about what these different classes mean. I know enrollment began this week, and there's perhaps some confusion about what this means, how it is going to show up on your transcript in Triton Link. I want to direct you to the registrar's office, which gives a lot of good information about not only UC San Diego's plans for hybrid remote courses, but gives definitions of what these courses mean so that you have a better understanding of what you're registering for. You can see some examples of those questions here. So feel free to visit the link below. Feel free to just take a photo of this if you want. That's the easiest, to go visit that site, and this will help you through the process. So I want to go back for a moment and spend some time clarifying the I-20 NDS 2019 remarks for our students attempting entry this fall with in-person coursework. So the July 24th guidance clarified that these are actually not required. However, ISPO can still provide these if requested. Okay, so though they are not required, we know students have had some issues at their visa appointments or entering the United States, and we want to make sure you're prepared and supported. So again, you can fill out that amendment request and have these notes added. Again, it's not required for SEVP transfer students. It's not required for students entering for winter or spring 2021. And I also want to draw your attention to a travel support letter that we have available for all of our new and continuing students in the iPortal. So this travel support letter, again, describes UC San Diego's plans for hybrid instruction this fall. It also clarifies that our students are able to enter up to October 16th. So I highly suggest you go into the iPortal under the notification section, and you can download this letter to bring with you either to your visa appointment or to the port of entry when you enter the United States. And again, here's the address for iPortal. If you're remaining outside the US with 100% online classes or deferring, or you're starting your winter 2021, I just want to really stress you do have to submit a request to adjust your documents. It will not happen automatically. If some of you are considering deferring your program, that is not taking any classes for the winter and starting your program not taking any classes for the fall, but starting your program in the winter, this is also a place you need to go to request an adjustment to your I-20 or DS 2019. And I'll go over deferment options in a moment because it's a multi-step process to actually do this piece. So deferring options for fall 2020. We know that some students prefer not to start their programs completely remotely. They might want to start at a later time to accommodate their preferences for taking their classes, and that's fine. If you have any questions about deferring, we advise you to please contact admissions here at admissionsreply@ucsd.edu. Deferment is not guaranteed. Each request is handled on a case-by-case basis. So if you have questions about this, if you're considering this, we also recommend speaking to an admissions officer. You can do so through their virtual advising, which I've linked to here, and they can go over your options. So before you're making any adjustment requests to your I-20, you need to talk to admissions first if you don't want to take any classes for fall, that is, start your program later. I also wanted to just make note about taking classes at another university during the deferment period, because this has come up quite a bit. UC San Diego is not able to grant UC credit for courses taken at other universities by newly admitted students. Only continuing students may be able to take courses at other universities and receive transfer credit for those courses. So newly admitted students, and this applies to both international and domestic students, who receive approval from the admissions office to defer their offer of admission, again, are not able to enroll in college courses during the deferment period. If a deferred student enrolls in a college or university courses, the deferment will no longer be valid, and students will have to reapply for admission as a transfer student in a future application filing period. So just keep this in mind if this is something that you're considering. Okay, so we know that starting your program at UCSD will look different depending on whether you're starting remotely or in person. I'd like to spend the next portion of this webinar going over some of the common checklist items, what new students need to be aware of, and how this will look for you depending on where you will be this fall. We'll start with housing, and then we'll move on to health insurance and immunization requirements. And then finally, we'll touch upon orientation and onboarding programs to help you get adjusted to student life at UCSD. So now I'll go ahead and turn this over to my colleagues, Sabrina and Pachia.
Thank you. Okay, great. So my name is Sabrina. I'm with Housing and Dining on campus. Go ahead, go to the next slide, please. Okay, so housing information for undergraduate students that are starting in person. So this slide is for those of you that are planning to be in person fall 2020. First thing you'll need to do is to decide whether you will quarantine on campus or if you will quarantine off campus. If you have an off-campus lease and will be living off campus, then you can self-quarantine on your own in your off-campus apartment. If you have a fall 2020 contract intact, you can do one of two things. You can either make arrangements off campus to quarantine with family, friends, or at a local hotel. There are some international students who may have some family members in the United States, and it is perfectly all right for you to land with them, quarantine for 14 days with them before coming onto campus. Some of you may prefer to self-quarantine at a local hotel, and on our HDH COVID FAQ website, we have a list of local hotels that have pre-negotiated rates for those 2 weeks if you wish to do that. However, if you also have a fall 2020 on-campus contract, you can quarantine with us in our program. And the way to apply for that is to go to our housing website under undergraduate students. You go into the housing portal, and there is an application there for quarantine housing for students arriving from international locations. You will be quarantined in a specific building on campus. It's not going to be the building that your fall quarter contract is in. It's a completely separate one that you'll only be in for a short while. There will be no additional housing room charges during that quarantine period, but you will be charged for the food that is delivered to you. Next slide, please. So the way that program works, again, start off with where to apply. And applying is at this website here if you want to take a snapshot with your phones. It's basically our housing website, going under current residents, and then there's a link on there that says housing portal. You log in, and there is an application available there for you to let us know when you can arrive. Once you've completed that application and we've taken down your information on when you can arrive, you will receive instructions via your UCSD email account on where to go, where to pick up your key for your specific quarantine apartment. You will have an apartment to yourself. We do want to let you know, though, that you will need to arrive only with the items that you can carry or wheel by yourself, as there will be no moving carts available because this whole process is a contactless process. So you won't be able to have somebody help you with boxes. If you have boxes of items that you want in your permanent housing location, you can have that shipped to you later on after September 28th. When mail services starts to deliver packages. But for the quarantine purpose, we really just want you to come with, clothing and personal items that you will need during the quarantine process. So whatever you can carry or wheel by yourself, that's how we want you to arrive to campus so that you can easily get to a PO box that we're going to assign to you. You will have a combination that we will give to you ahead of time. You will access your key and be able to let yourself into the apartment that is assigned to you. You will also have a phone number in case you run into a problem or you can't get to the PO box or you find something wrong with the key. There will be a phone number for you to call so that somebody can come assist if you're having a problem. The apartments, again, will be single occupancy. They will be furnished only with the following items. There will be a bed, there will be a desk, microwave, shower curtain in the shower area. There will be linen for your bed, towels so that you can shower. Toilet paper will be provided and a pillow. And Wi-Fi connectivity will be available in your room. As far as food goes, we will deliver food to you, deliver it to your apartment door. So that will be basically breakfast, lunch, and dinner. There will be an option when you apply to alter the amount of meals that you wish to have per day, because there are some students that want 3 meals a day and some may only want 2 meals a day. So there'll be an option there for you. If you have any dietary restrictions or specifications, there'll be a spot there for you to designate that as well so that we can help you out with that. Once you are done with your 14-day quarantine, you will not necessarily be able to move to your next permanent room assignment that following day. It will depend on when your move-in date is set, but you are fine to stay where you are in that quarantine apartment until the date and time arrives for you to move to your permanent fall room assignment. And all of those details will come to you later on when room assignments are done. And that will be at the very, very end of August when you find that out. Okay, so either way, you're A-okay. We'll have you in quarantine housing and you will stay there until we have your permanent room ready for you to move into. Okay, next slide. All right, so that's how that is going to work. This is our contact information for housing. That's the email account and the web. That's just the general base website. If you have to look anything up, feel free. And we're here to help. Thank you.
Thank you so much, Sabrina, for that. We're going to go ahead and move along to Jill now, who's going to talk about immunization and health insurance requirements. We're just having some tech difficulties. Bear with us one moment while we get Jill set up. Bear with us just one moment. We're just having some tech issues, but we'll be right back online in just a moment. In the meantime, maybe we can answer some of the questions that have come through. So we've gotten some good questions. One of them, let's see here. Someone has the question, before arriving in the US, I'll have to quarantine in another country. Would this be enough, or do I have to quarantine twice, one time in another country and once in San Diego? So we recommend that you take a look at our quarantine website. My understanding from the San Diego Public Health Order, and this is not just a UCSD requirement, but it's a public health requirement, is that you do have to quarantine here as well. So make sure that you visit our information on our website, which I'm going to be posting at the end of the presentation, so you're aware of what you need to do when you arrive in the United States. And it sounds like Jill is back online, which we're really happy to hear, and go ahead and turn it over to her.
Good afternoon. I'm sorry about that. My name is Jill Batika, and I'm the insurance manager at the Student Health and Wellness Clinic on campus at the UC San Diego campus. I'm hopefully going to provide you with some information about the services that we provide at the Student Health Clinic and the health insurance requirement, as well as I'm going to cover the health requirements with you today. We refer to the Student Health Insurance Plan as SHIP or UC SHIP, so you'll hear this a lot. It just stands for Student Health Insurance Plan. The insurance plan is administered through Anthem Blue Cross PPO, and they are recognized nationally throughout the US as well as globally. I just wanted to make sure that it is clear to all students that the requirements of a registered student, whether you're distance learning or on campus or doing a hybrid program, all of the compliances and requirements are the same for all students. So if you're distance learning, we have a little bit more flexibility with the waiver process this year for the fall quarter. But I just wanted to make sure that you understood that the insurance requirement, the health insurance requirement that's set in place for students, as well as the health requirements, they're for everybody. So you have to comply with them in order to remain a registered student through UC San Diego. The students that are undergraduates, their tuberculosis risk screening tool, that was due on August 1st. So some of you may be experiencing holds on your account that will prohibit you from registering. What I would suggest that you do is to fill out that tuberculosis risk screening tool as soon as possible. And then you're going to go through a system called My Student Chart, which we're going to talk about in just a minute. And you want to send a message to Ask a Nurse, and they'll be able to verify that you have met the compliances and lift that hold from your account so you can register. Also, we do provide tuberculosis testing in our clinic, but I strongly suggest that you have it done by a private provider and then supply the results to us via the My Student Chart so that can be verified. At our student health clinic, we have a comprehensive primary care physician clinic. We are centrally located on the campus. We're directly across from our Price Center food court and right down the library walkway from our Geisel Library. We provide physician and nursing services. We have lab, x-ray, pharmacy, and optometry services in our clinic. Services are available to all UC registered students throughout the state of California, not just San Diego. So if you're visiting another campus, you could utilize them as well. The clinic is not open to staff or the public, so we can have a lot more accessibility and availability to our providers in a sooner time frame. In order to make an appointment, what you want to do is give us a call at that 858-534-8089 number. You can speak with someone and set an appointment that's appropriate for you. We have women's health services, men's health services, and also sports medicine available to students, as well as our primary care. If our clinic is closed, then we have an after-hours nurse that answers our phone line and can guide you to the next level of care that you should be achieving, or ask you to wait till the next day to give us a call if it can wait. It's not just for the students that have the insurance plan, it's open to all students that are registered at UC. So you can contact that nurse line to get advice as many times as you'd like to. We are one of the only places on campus that is open all year round. So we've been open through this pandemic, and we're available to assist with any kind of services as well as COVID testing. The health insurance requirement is of all students that attend a UC campus, graduate or undergraduate, there are no exceptions. The insurance that's offered to students is referred to as a health fee on your registration fees on your student account. And you'll see that for this year, for the undergraduates, the cost per quarter is $692. That is charged to you 3 times within an academic year, fall, winter, and spring. And the spring includes the summertime. The fall and winter are about 10 to 12 weeks. And then the spring and summer are just about 6 months of coverage. You're paying $692 per quarter. Most services at our student health service clinic, which would be your primary care physician clinic, are at a reduced cost or no cost to you. The only things you would be paying out of pocket for if you do have the student health insurance plan would be prescription copays, a copay to come through our urgent care if you can't make an appointment, and that's $20, or any over-the-counter items that you might want to purchase, like a thermometer, cough drops, cough syrup. The insurance that's offered to you, it is medical and pharmacy. Those are unlimited in the payout that they will to a provider. The dental, they will give you $1,000 worth of curative dental coverage. And on the vision, that is limited. They will give you 1 eye exam per academic school year, and they'll also pay for a set of glasses 1 time per school year. This benefit also is worldwide. So if you have to travel for work, school, or you're going somewhere for fun, you just want to contact Anthem Blue Cross and let them know where you're going. They contract with over 200 international entities, as well as can direct you for care if you are stranded somewhere or if you get into a bad situation. So it does cover you globally at a 60% rate if you are outside of the United States, and it becomes a reimbursable plan at that rate. That means you pay up front and you seek reimbursement when you come back to the United States. At our University of California, many of our schools are lucky enough to have major medical centers attached to their campuses, and we are one of them. We have 3 major acute hospitals that are near our campus right across our 5 freeway. And also at those hospitals, we can provide over 200 specialty physician programs. We have state-of-the-art diagnostic services and surgical interventions. There are some world-renowned physicians and surgeons at our campus hospitals, and it's always a better benefit if you're utilizing a UC system hospital. Under the Anthem Blue Cross plan that you would have through this school, it is a 3-tiered model of benefits. The first would be that you use a UC family provider, a hospital, or a specialist if you have to be referred out outside of primary care. Those services would be covered at 90%. A $10 copay is required for a physician specialty care visit, but 90% for any diagnostic or hospitalization with no deductible. The second tier of those benefits would be the Anthem Blue Cross network, and you could visit an Anthem Blue Cross network provider and pay a $30 copay for a specialist. 80% would be covered for any hospitalization or diagnostic service with a $500 deductible. And then you have an out-of-network benefit that's covered at 60% with a $1,000 deductible. We don't highly recommend that because a lot of students don't have a lot of money to pay medical bills. So if you need assistance, you can certainly contact Anthem Blue Cross to find providers, or you can come down to our insurance department in our clinic, and we'll be able to assist you and find providers. The breakdown of coverage is there provided for you, and also on our website, you can get a better understanding of the benefits and the details of your coverage. One other thing I'd like to point out is that we do not mail out insurance cards. We try to be ecologically minded, and we ask that you download an app to your mobile device, your phone, or your tablet. It's Student Health, all one word. Once you download that, you'll be able to visualize your insurance card. You can send that to a provider if you'd like electronically. You can visualize your benefits and also look at claims that might be processed under your subscriber identification number with the insurance. If you have insurance under your parents privately or through a government entity, like your home country insures you, that meets our waiver criteria. So that means that if you don't want to pay for the health insurance that's offered through the school, we want to make sure that you have adequate coverage that you can use on your own. But we do ask that you file a health fee waiver. You have to do that during the open timeframes. This year for our incoming fall students, our health fee waiver is open currently on our Triton link from May 1st to September 1st, and then it's reopened from September 2nd to the 9th with a $50 late fee. After the 9th, you unfortunately would be out of luck and you would have to pay for the insurance that you're automatically enrolled in through the school. If you have insurance through your parent, you will be required to submit an insurance card and a brief summary of benefits or an explanation of benefits that shows what your coverage entails. Once you submit that through the Triton link, a decision is delivered to you via email within 5 to 7 business days. For this school year, for the fall quarter with our distance learners, if you can provide evidence that your home country does insure you, or you have a private plan that insures you in your country, we need you to submit the waiver through the Triton link. If you are denied, you will be offered an appeal. If you fill out the appeal and email it to me, I'll deliver a decision within about 2 to 3 days. And generally what I'm doing is just going in and approving your waiver for the fall quarter. So we do have the flexibility this year to approve you if you are staying in your home country doing distance learning. Just explain that to us and provide your student identification number and your name. The appeal form will speak for itself. If you come into our student health clinic and you waive the insurance requirement, you're still welcome to come in. You just have to pay as you go. And we'll talk a little bit more about that. I wanted to offer you also for the international students that want to possibly opt out of the health insurance requirement that we have and purchase an online health insurance when you do come over to the United States. These 3 plans, ISO Care Plan, PSI Platinum Plan, and Student Medicover, which is offered through United Healthcare, those 3 plans are recognized and approvable under our Office of the President through the University of California as plans that meet our waiver requirement. If you purchase one of those plans and you file the waiver through our Triton link, we will be approved for a waiver and you won't have to pay that $692 per quarter for this academic year. Just something to keep in mind for the students that do choose to waive the school offered insurance, you're still welcome in the Student Health Center. If you have any care needs, you can certainly call our after hours nurse line. You just have to pay as you go on when you do come into our clinic. One office visit at our student health clinic with a physician usually runs from $79 to $99. And then charges can be added based on if you need a lab service, an x-ray, or a prescription. So that can add up pretty quickly. So you need to be prepared to pay at the time of service for any kind of services that are rendered to you. If not, we will transfer those to your student account where you can pay that through your statement due date. And we'll assist you with getting any kind of receipts that you might need to seek reimbursement with your insurance plan on the outside. We don't contract with any insurance companies other than our student health plan. So we'll help you get reimbursed, but we can't bill your insurance company if you do file a waiver with outside insurance. If you do choose to waive the school offered insurance, on the waiver application, you'll be asked, do you want to grab a RAFT? And RAFT stands for Reduced Access Fee for Tritons. This is basically a membership to come into our student health program and not pay additional monies for any kind of physician services, x-rays, lab services. So what this is, when you come to the United States and you're near campus, if you do file a health fee waiver and you want to come into the student health clinic, you can pay $65 per quarter for some peace of mind that you can walk right into the student health clinic on campus, have a scheduled appointment. You can have unlimited scheduled appointments and in-house lab services at no additional charge. So paying $65 per quarter prohibits you from having to pay that $99 physician fee. If you do need to get a prescription or you need to be referred to a specialist or have a diagnostic service, the physicians at the Student Health Center are going to walk you down to the insurance department, where we're going to assist you in finding the right provider under your outside insurance to go see and seek out those recommended services like a prescription or specialty care. And again, we don't contract with insurance companies, so we can't bill them, but we'll help you try and get reimbursed. When you're here in winter and spring, you can walk right on campus and be seen by any of our physicians. The accessibility is very good, and you can usually be seen the same day or at the same time that you walk into the clinic. If you do have any questions about anything that we just discussed, I know it's a lot and it's overwhelming, please contact us at 858-534-2124, or you can email us at ship3. Our offices in the insurance are currently working remotely, but we'll answer you very timely, and we'll try to assist you with any of the answers that you need, because we know that you need that for registration or to access the next level in your enrollment process through the school. We look forward to assisting you with any of your healthcare needs, and if you do have any questions, let us know. So I'm also going to go over the health requirements. Our presenter, Annie Horton, she is our lead nurse at our student health clinic, and she's currently running a COVID clinic where she's doing testing for students that are doing their symptom tracker and they have symptoms. So she's doing lots of swabs today, but I'm going to speak on her behalf, and I'm going to try and answer your questions as best as I can. If not, then you're going to go to Ask a Nurse, and they'll be able to assist you. So you have health requirements for coming into the University of California, and again, all students that are enrolled and registered at a UC, they have these same requirements. For the tuberculosis risk and screening, we just want to make sure that you're not a positive risk in here on our campus. The way that they do test for tuberculosis would be a skin test, a blood test, or a chest x-ray, and we'll talk about that. But make sure that you go in and you fill out that tuberculosis risk assessment if you haven't already. And if you need to get to a health provider, now's the time to do it so you can register for classes. If you do have a hold, let us know and we'll help you with that. The immunizations that we're looking for is that you have immunizations for Tdap, which is the tetanus with pertussis immunization, measles, mumps, and rubella, also known as MMR, varicella for chickenpox, and for those of you that are under the age of 22 years old, a meningococcal MCV4. Proof of these vaccines or immunity via a blood titer are what we would accept as verifiable requirement meet. Why do we request you give us this information? It's basically to protect you first, and anybody in our community, your friends, your classmates, me, anybody that you're around. If you don't have these immunizations, you can spread any of these diseases. And as you see, we're going through something like that right now. And there are outbreaks with some certain disease processes. And we want to make sure that everybody that is at UC San Diego is successful and can enroll in classes and meet the educational standards that they're trying to. So we just want to make sure that you're protected. If you do have medical reasons that you can't have immunizations, you're going to want to go through our Ask a Nurse process, and they'll be able to guide you with that. How do you give us that information? What you want to do is go into the My Student Chart portal. On the browser, you want to go to mystudentchart.ucsd.edu/SHS/. What you'll need is the UCSD issued student AD login along with a password that you've developed. And then if you have any issues technically with that, with logging in there, you'd want to visit the blink.ucsd.edu technology site, and they'll be able to assist you or let you know what's going on. You may have to switch browsers. It might be very simple, or they might have to look into it. but definitely go on mystudentchart.ucsd.edu. That is our first and foremost line of communication with you on your healthcare. When you get onto My Student Health, what you're going to do is click on the health icon, and that's going to take you to the Student Health Service site. The second step for those that are new incoming students for Fall 2020 is to click on Fall 2020 students. Any other incoming students, students returning, or that have to verify their tuberculosis requirements, you're going to click on All Other Incoming Students. And then you're going to download the requirements, you're going to fill out the information and upload any information that we might be asking for. Also, if you have any questions about counseling or psychological services, anything to do with mental health, we do partner with our CAPS team. Our CAPS website is at studenthealth.ucsd.edu. There's a link you can click on CAPS, and it'll also take you to resources and different information that you might be looking for to assist you with your mental health needs. So on the immunization requirement, what you're going to do is click on the TB screening. You're going to fill out a short questionnaire, and it'll assess your risk for tuberculosis. It may ask you to get a health provider to sign off and make sure that you are negative, and upload that back into the system so you can meet the compliance. After you fulfill the TB screening, you're going to go on to the immunization history screening, and it's going to ask you for dates for when you got those vaccines and how they were given to you. And it'll also ask you to upload a copy of your immunization form or a vaccine card that you can provide to us that will also fulfill that requirement. The tuberculosis risk screening for undergraduates was due on August 1st. So anyone that is experiencing any issues with their registration, please get in there and fill out that risk assessment as soon as possible. If you're prompted to do so, they might need you to go get TB testing from a healthcare provider. Please do that as soon as you possibly can. We know that the challenges with the pandemic may make you wait a little bit longer to do that, but as soon as you can get that TB testing done and be in compliance with our requirements, please upload that as soon as possible. The TB testing, it can be shown by a TB skin test, a negative test, a blood test, which we refer to as quantiferon or T-spot, that shows that you are negative, or a chest x-ray. And a lot of countries, they do provide a chest x-ray as the first line, which is fine. We'll certainly accept that. We just need a reading that can show us your compliance with that process. You want to upload the testing form that the healthcare provider has given you to My Student Chart, and the nurses will review this, and they'll contact you if there are any questions or if they have any concerns about your readings. If you do have questions about the requirement, or if you want to contact one of our nurses, definitely use My Student Chart to contact a nurse. Otherwise, look on our wellness.ucsd.edu website, and it'll go over the TB assessment information. The immunization requirements for all students, graduates, and undergraduates is November 1st. If you haven't done that, you do still have time to do that. Also, if you are attending on campus, you can come to the Student Health Clinic and fulfill that requirement if you do need to get any vaccines. If not, if you are a distance learner, you will have to make an appointment with your healthcare provider, get your forms updated, and then upload them to your My Student Chart so you can fulfill that requirement. And again, please complete this as soon as possible. If you don't do it by November 1st, it will affect your winter 2021 quarter enrollment. On the immunization form, when it's asking you to fill out the information, if you hover above the little eyes, it'll give you a little bit more information about what an MMR is for and why we require it. And then it's going to ask you to fill in the date and the vaccine information that was given to you so that you can fulfill this requirement. If you do need help, I strongly encourage you to send a message through Ask a Nurse or to give us a call at our main line, which is 888-888-3300. One of our nurses can assist you on the phone, or if you send them a message, they'll usually respond to you within 24 to 48 hours. If you're having any problems with your tuberculosis screening, please email us at studenthealth, which is shstb@ucsd.edu, and we'll help you with any technical difficulties, as well as if you have any questions, we'll address that as well. Also, if you have questions about the requirements, please again visit our website at wellness.ucsd.edu. And also for graduate students, I know they're not on here today, but they do also have a division website where we download a lot of our information, where you can find that as well. But complete your requirements as soon as you can, and that way you won't have any issues with enrollment or registration. Thank you, and one of our nurses will reach out to you if you do have any questions. I will answer any questions that you might have here. Hopefully I can do that. I'm not a clinician, but I can always take them back to the nurses who can answer them for you as well.
Thank you so much, Jill, for that. And yes, we had some questions come through. Hopefully we can get those answered, but as she said, you're free to direct those, or we can direct them over to Student Health if they're more specific. So I just wanted to take the last few minutes here to go over some resources about getting started at UC San Diego. Again, this is for whether you are starting your program remotely or in person this year. Okay, so the first thing I want to draw your attention to is our new international student orientation. This is required for all newly admitted international students who are starting their programs this fall. And the great thing about orientation is that it is completely virtual this year. And we are offering our different sessions at different times on repeat so that it is accessible to all different students in all different time zones. So I recommend going to iorientation.ucsd.edu, and you can find information about how to register. This is, of course, this presentation is part of our pre-orientation program that you can see here, running from the 10th to the 19th. Our fall orientation begins on the 8th of September, and you can see just a sampling of some of the different workshops that we're offering there. In addition to those workshops that are specific to international students, we have different social activities, ways to connect with your peers, meet students virtually, both international students and domestic students in different social settings. We have an international student mixer that we're going to be hosting, and a whole host of other activities. So we really encourage you to go to our website, register now. You should have all received an email, and you'll be getting more emails from us to remind you to register for orientation. Again, it is required, so go ahead and sign up for that now. I also wanted to let you know about the programs that we are continuing to run virtually this fall and potentially beyond online. So these are programs that ISPO has been running for several years in some cases. Some of them are newer, but I just want to briefly go over what we do offer. If you go to iprograms.ucsd.edu, you can join any one of these programs. I want to highlight our English in Action conversation program. This has been around for more than 20 years. This is a great way to practice your English language skills, conversation skills with a native speaker here at UC San Diego. So I highly encourage you to sign up for that if that's something you're interested in. We also have our international peer coaching program. This is a great way to be matched up with an international student who is either a sophomore, junior, or senior at UC San Diego, and can really help show you the way in getting started at UC San Diego. Everything from academics to getting involved. And what's so wonderful is that they've had the same kind of experience of adjusting to life here in the United States. And so we encourage you to check out the International Peer Coach program as well. We also have social programs like the coffee hours at ISPO, our I Thrive program, our different intercultural communication workshops, as well as our intercultural social hour. So take a look whenever you get a chance at iprograms.ucsd.edu. And here's some more resources and information for fall 2020 as you're planning. We want to make sure that you're aware of everything that the university has to offer to provide information to you so that you can be the most informed before you come to campus. Our Return to Learn website is the campus's website that gives up-to-date information about campus status, what the campus is doing to implement safety protocols, how the campus is going about its daily activities, academics, everything that you can think of, resources for helping you with your academics and so forth. So you go to returntolearn.ucsd.edu. It's a great site for you to take a look at. Of course, the ISPO website, we want you to be aware of issues that pertain to you specifically as an international student. So we've compiled frequently asked questions on our website that deal with a lot of the questions that you're asking for fall 2020. It also, our website provides current campus status updates, again, COVID-19 campus notices. So if you go to istudents.ucsd.edu, there'll be more information for you to look through. Travel resources and tips. Our ISPO site, again, itravel.ucsd.edu. This is a page within our site that goes over everything that you need to physically enter the United States, what paperwork you need. And it's a great way to make sure that you have everything to hand before you come into the United States. Up-to-date travel restriction information is also going to be located on the travel.state.gov website. This will give up-to-date information about what travel restrictions currently exist, what to be aware of when you're planning your arrival into the United States from your home country. Consulate appointments and closures. We know, of course, this is a big issue for so many of our students that the consulates and embassies are closed. You can keep up to date with the closures and when appointments are opening back up by going to the official usembassy.gov website. And finally, the quarantine housing resources. Sabrina did mention these a little bit earlier, but you can take a look at the link here. They have a great FAQ section that goes over what to expect in quarantine housing on campus, what resources are available for off-campus quarantine housing. So this is a great place to start. Their contact information is there as well if you have specific questions about registering for quarantine housing. Okay, so I know we have used fully this hour to present information to you that we hope was helpful. I know we had some great questions come through. I see they have all been addressed or answered in some way by our staff. We want to thank you for that. We want to encourage you to take a look at our other orientation programs that are coming up. As I mentioned, we're just getting started here. So go to iorientation.ucsd.edu to register for further sessions coming up in the next couple of weeks, as well as in September. So again, whether you're joining us from inside the US or the other side of the world, on behalf of the International Students and Programs Office here at UC San Diego, enjoy the rest of your afternoon, evening, or morning. We'll see you all at our next session. Bye-bye.